Hello KBC, this is Dave Gannulin, the owner and founder of Kettlebell Concepts, along with Dr. Emily Splichal, who has graced us with her presence today, and we're going to chat with her a little bit about what she's doing, her evidence-based fitness academy. Did I get that right?
You did.
Okay. And we're actually very excited to have her on faculty now. Emily will start to be leading level 1 classes as well as the group exercise classes, and we're going to talk a little bit about what she's doing, because this is really exciting stuff. So why don't you start by introducing yourself, telling a little bit about your background and who you are and what you do.
Okay. Very excited to be here. I am a doctor, podiatrist. I have a master's in human movement. I have a master's in public health. I have NASM corrective exercise, performance enhancement, and NSCA certified personal trainer. So
that's not enough. I think you need more.
When I introduce that, I say, so this means I got a lot of debt.
Right. Oh, okay.
I got a lot of school debt. But yeah, so I am dedicating my medical background to the fitness industry.
Oh, fantastic.
And that's why I went to podiatry school, was to further myself in the fitness industry and further the industry as a whole in kind of medicine, biomechanics, human movement.
That's fantastic. And now this evidence-based fitness academy, this is brand new? How old is it?
I started at end of 2010.
Oh, okay.
So it's fairly new, but it's picking up.
Seems to be.
Very fast.
Right.
And a lot of it, it's based around kind of this concept of evidence-based fitness, which I bring from the medical community, where we do evidence-based medicine.
Okay.
So in the medical community, when you treat a patient, you follow all the latest research, and that's kind of your practice guidelines.
Okay.
So you'll get the best results with your patients, the best outcomes, the best compliancy, if you follow the research.
Right. Like actual real peer-reviewed journal research.
Yes,
okay.
yep, like peer-reviewed journals. So in the fitness industry, I think having that same philosophy and concept is so important.
Okay.
Where I guess my biggest pet peeve is kind of what I call monkey see, monkey do trainers.
Yeah.
Is seeing an exercise, thinking it looks cool, but not really knowing what they're targeting.
Right.
So if you don't know what you're targeting, you don't know how to progress or regress a movement. So if you look at the research, you really understand human movement, biomechanics, muscle function, muscle activation, you will not only not injure your client, but you will get better results.
Right.
Whether it's athletic performance or weight loss.
Makes sense. Yeah. And how many times have you seen a trainer pick up a kettlebell or something else because they saw another trainer doing it?
Yes.
So you're going against that, which is wonderful. Now, you've been picking up steam. There's a lot going on. What are you working on now? What's in the hopper? Because you seem to be everywhere.
Yeah, making little guest appearances.
That's good.
But yeah, so we have a lot coming up for EBFA. Between our workshops, I do a lot on functional foot and ankle, barefoot training, evidence-based core training. We have workshops every month, about 6 to 8 workshops.
All over the country.
All over the U.S.
Okay.
Again, April we're full, May, June, and then we're starting to book July through August.
That's great.
All of our workshops are listed on the website.
CECs for it?
Yep, we have NASM, ACE, AFA, NSCA.
Great.
And submitted for athletic trainer CECs as well.
Oh, that's good, yeah.
So trying to really hit the industry strong, and not have somebody take a workshop because it doesn't offer the CECs.
Right.
That's kind of the reality of it. Is people still think about the CECs.
Yeah.
So and then I'm actually doing a research study, which I'm very excited, since everything I do is based on research. So
it's going to be published. Like you want to publish it. Fantastic. Can you talk about it?
Yep. It's a plantar fasciitis study.
Oh.
And I'm looking at myofascial compression technique.
Okay.
Which it's kind of getting out there in the fitness industry. This technique, and trying to show that it's more effective than stretching.
Really?
Yeah. So I think that for my patients, for athletes, for kind of the lay population, if you could get a higher efficacy from this technique, it's huge. Because a lot of people stretch without really looking at it. They're doing something that we were told to do like 30 years ago. Versus, let's see what the latest research is.
That's great.
So
something to be on top of. You know?
Yeah.
You could present that at Galvanized.
Yes.
September, Galvanized.
Yes.
This year. Fantastic. Let's talk about kettlebells a little bit.
Okay.
Okay. You took the level 1, and you came to me after, and you had a couple of really interesting points about something that you thought, let's just call it a module, might be a nice progression. Can you talk about that a little bit?
Yep. Well, the kettlebells to start off, like reignited my passion for fitness, which is awesome.
That's great.
After doing fitness for over 10 years, I think you kind of like, you know, I've been on the spinning bike for 10 years, you know, need something like new, spice it up.
You were personal training and group X, you kind of did
everything.
Yeah.
Did it all.
That's great.
And the kettlebells, again, like I was saying, kind of reignited that passion. It was like, oh, I want to work out again. So kind of started working out again, doing it, and then saw the way that you can use this, again, not just for athletic performance, but I work with a lot of clients and health clubs on weight loss, like large amounts of weight loss, where people are initially scared of the kettlebells.
Sure, yeah, they could be.
But if you understand the technique, again, the effectiveness of this modality is huge. For weight loss, huge.
Absolutely.
So, but again, kind of going back to that module, the one thing where I come from, I guess my medical background or my human movement background, is if people are not assessed before doing them, assessed for both mobility, stability, muscle activation, they will move that kettlebell in any way that they can, right? Whether they're using the proper muscles to move it, right? So I was a gymnast for 13 years. So I'm very strong, kind of the outer muscles. And then when I started doing Pilates and really broke down into those deeper muscles, I realized that I was using my larger kind of like global muscles to move me and stabilize me as like kind of my powerhouse versus the smaller stabilizing, like the deeper muscles.
That need to be filled in.
Yeah, so again, if those imbalances are not kind of determined, or those imbalances in a client, and you throw them in the kettlebells, they'll still move it, but the risk of injury could be there. Yeah.
Sure.
Yeah.
So you're thinking in this module that you're going to be developing for us, and there'll be more on that, is what more specifically?
Kind of figuring out muscle activation through it, synergistic dominances. Because I'm a podiatrist, everything has to start in the foot.
There you go.
And I build this foundation in a lot of my classes with EBFA. Is let's look at the foot, let's understand the foot, and then let's kind of like really free up the foot. So if you don't free up your foundation, you're not gonna, the rest of the body cannot move the way that it's designed. Which, bring it back to kettlebells, if that foot is not moving your foundation, then you're gonna be recruiting all these other muscles. Kind of you're not integrated. If that makes sense.
I can't wait to see what you come up with, because I think, you know, there's no studies on this, but I imagine anyone who's doing gear avoid sport or anything like that, it's got to help. I mean, it's purely anecdotal at this point, but I'm real curious to see what you come up with. I can't wait. So, now, last but not least, there was an interesting question that we talked about earlier regarding the relationship between the medical community and the fitness community, the fitness professional. Care to elaborate on that?
I think it's getting better.
That's okay.
The relationship. I'm not as bitter as I was. But no, I think that it is getting better with the whole advent of medical fitness specialists and medical fitness academies, where you can be kind of a certified clinic or whatnot for medical fitness. Where I see working in a hospital and working with patients is an integration of, how can I say, Western medicine is very subspecialized, subdivided. My interest with podiatry is not looking, I can't look at a patient as just a foot. I can't. That just goes against.
You're fired. That's it.
I know. It goes against what I learned, my belief. You know, as a gymnast or as a trainer or a human movement specialist, that just goes against. You can't look at the foot isolated.
And do you find your colleagues tend to do that, or?
They do. They do.
I suppose you can argue that. I suppose you can argue that about any surgeons want to cut.
Right. Surgeons want to cut. Surgeons want to cut. One thing that I find very interesting is when you do surgery, and this is kind of something that I'd kind of like to tap in a little bit,
Uh-huh.
is say you have a flat foot, just looking podiatrically. If you have a flat foot, there's a lot of compensations in the rest of the body.
Okay.
I go into this in my lectures, I write about this. If you go and you surgically correct that flat foot, right, but you're looking at just that flat foot as, say, a foot surgeon,
Okay.
right, and you don't understand the rest of the compensations, and now you totally straighten up that foot surgically, but you
Right.
don't reverse any of those compensations, you're almost getting a compensation from the compensations, because now you're thrown back into like a proper foot posture,
Right.
right? And then a lot of foot surgeries are fusing. So I'm fusing the subtalar joint, or I'm fusing the ankle,
Okay.
I'm fusing the midfoot. That has to change the rest of the way the body moves,
And
kinetically.
they don't address that.
They don't.
Huh.
They don't.
So there may be problems down the.
Yeah.
Okay.
Yeah.
Well, you have this nasty habit of looking holistically. Shame.
Shame on me. I know.
Right,
I'm
right.
sorry.
Well, it sounds like that made you a bit of a rebel, but you're out there.
Yeah. I'm trying to question things. I feel like that's the way that you further an industry
Right.
or profession,
Right.
is you have to start questioning things. You either accept what you're told, or you say, well, that's not,
Right.
That doesn't quite make sense.
Right.
So,
That's no wonder you like the kettlebells, It's like, no, throw around these iron weights. That's good for you, really, we promise.
Yeah. Yep.
Well, you're doing a lot, and I wish you the best of luck. Now, people can go on to the website for more information, right? What is that?
Yep. The website for EBFA is evidencebasedfitnessacademy.com.
Okay. And they can contact you through there if they needed to.
Yep. And all of the courses are also listed on PT on the Net.
Oh, great. Yeah, they're good people there.
Yep.
Excellent. Well, thank you so much for stopping by.
Oh, thank you.
I wish you best of luck with EBFA. Continue best of luck. And also, when you roll this module out for KBC and getting you as many classes as we can.
Yep.
So,
I'm excited and galvanized.
and galvanized, exactly.
Excited.
Can't forget about that. All right. Thank you guys for listening
Thank you.
so much. And we'll have more people as the months go